You're listening to the Grit to Growth podcast. Real talk with real business owners and professionals who built their freedom the hard way and now want more time, money, and impact.
Hello, everyone, and welcome back to the show. I'm your host, Levi with Mailbox Money, and today's conversation is about health in the real world. No quick fixes, no trends, but what sustainable care actually looks like. Joining me is Dr. Jennifer Schriever, a family medicine physician with Sanford Health, who now focuses primarily on weight management. Jen, thanks for joining us today.
Oh, thanks for the invitation.
Yes, we are glad you were able to carve out some time to join us and fill in our audience about what you and Sanford are doing. But before we get into that, would you mind letting people know kind of your personal background, maybe where you grew up and how you got to be where you are today?
Sure. I spent most of my life growing up actually in Lincoln, Nebraska. My father worked for Valentino's and opened the one that was located here in Sioux Falls. So that's how I
Absolutely.
came to South Dakota. And then in the middle of undergrad, I was at the time. So ended up graduated from South Dakota State, USD for medical school, and then my residency training here in town. Lastly, since I might as well include most of the colleges, I got my MBA at Augustana just a couple of years ago. So attended
Nice.
all the local or most of the local ones. As far as my obesity medicine certification, just started that training in virtually through conferences during the pandemic. So got boarded in that in 2021.
Was that quite a bit different than what you were used to since you were doing it through COVID, or was it were they able to standard procedure?
For the education or
Yeah.
So there's two ways to board certify for obesity medicine. You can do a fellowship or you can do the education, 60 hours of education. And then the testing was different. Often that historically has been live at a testing center, but it was remotely monitored from your home if you chose to. So that was an
Interesting.
experience for sure.
Yeah, I can easily believe that. So you spent like about around 20 years practicing family medicine. What kind of led to wanting to focus on the weight management and obesity side of things?
Yeah, I did practice. I'd say I've been in practice since 2003, so about 20 years. I have always cared about nutrition and health. I think my perception is as a child, I can't confirm absolutely that I was maybe overweight, so I always paid attention to nutrition guidance. Really cared a lot about fitness and periodically certainly exercised when I could. And then when I learned, and I followed physicians online podcast and other things like that. And when I just came across the obesity medicine boards, I was really interested and actually spoke to one of my partners at the time, and she did them took them at the same time. So it just really fit what I was passionate about, learning and helping my patients improve their health, feel better, all that.
Good. I think many people still think weight management is just about eating less and exercising more. But from your experience, what do most people misunderstand about obesity and weight-related health?
Yeah, obesity really is a chronic disease and it's really not recognized as that. There are a lot of factors that make it such a complicated condition. The environment, your genetics, the life you grew up with, the trauma you experienced emotionally as a child, as well as a lot of internal function. So, our hormones, just to keep it simpler, our GI tract, people are into the microbiome, the bacteria in your GI tract. A lot is not known, but there is so many factors that is out of one's control. So if you really look at eating less and moving more, it really only contributes to about 3 to 7% of weight loss, and it's hard to sustain for most people. So, and you really need a lot of education. Our nutrition education throughout our lives hasn't been great. It's often influenced by industry. The nutrition science is really coming around as far as being better information that's available. And nutrition science is hard to do because, as you can imagine, we all live our lives. So, unless you
Yeah.
put a person in a room and keep them there for a while and know exactly what is going in their mouth and what energy they're using, it's really complicated.
So what does that look like when someone comes to you for weight management? What's the first kind of conversation typically, and then kind of first steps?
Sure. We do kind of act like primary care. We do a full history and as far as their past medical history, any surgeries they've had, we have them fill out a questionnaire so people can self-refer or get referred by their physician. And we want that questionnaire filled out before we see you just to shorten that first visit a bit, which is already at least 40 minutes. But we want to know how they've lived their lives. What is their experience been? What is their perception, the patient's perception of why they have weight struggles, what
Mhm.
they've tried, as far as various apps or programs or that sort of thing. What is their level of activity like? What is their exercise like? Sleep, stress, um,
Sleep's a huge one, isn't it?
everything, because all of that really matters. And our goal is not to create a program that you almost from. It's a program where you learn the lifestyle changes. A, that you're feeling good in the process, B, that it's working, and that we figure out each individual because it really comes down to each individual and how do we fine tune and help them guide them along that journey.
So a lot of it sounds like kind of doing a mindset shift, right? From like a short term, maybe like fad kind of diet to long term healthy and sustainable choices, right?
Yep, absolutely. And it has to be, the changes has to be something that feel good to you so that you can continue and be consistent with.
Sense. So I gotta ask, since you said your dad was the owner of Valentino's, are you guys getting in depth as that, learning family history and seeing if there was something like, oh, my dad owned, in a place that served pasta nonstop or anything like that? Is that part of the
Oh,
process?
absolutely. Absolutely. And certainly a lot of childhood experiences, if you think about your own childhood and just a variety of experiences, especially, I mean, negative ones and super positive ones, they stick in your brain like they were yesterday. And especially those maybe negative experiences from abuse to families struggling with food or access to food or moving a lot. Those sort of experiences lead to disordered eating sometimes. So, how you approach food, do you overeat? Do you stress eat, emotionally eat, not eat, or your level of activity? Or did your parents make comments about, the famous one mostly is clean your plate, but just a variety of experiences like that lead to how you lead to change your life. Certainly, I feel like growing up in such an Italian environment, I'm not Italian at all, but that restaurant, and then that also was the period of time when um, low fat was the rage, right? So
Yeah.
spaghetti was great, and the
Yep.
pasta, but in the end, the balance is better. So,
Yeah, absolutely. That leads me to thinking about the whole, yeah, how the thought process of nutrition and stuff changes over time. Obviously, the most famous being, the nutritional pyramid and everything. So I'm guessing you guys are always examining what maybe fads are or what's out there and adapting from there. Is that fair to say?
yeah, we have to, just because, well, patients, if we aren't aware, we have to look it up because a patient will bring up, a question or concern or about a variety of supplements. And should I do low carb? Or a lot of patients come in that they're already doing low carb. And so then we might have to tweak that for them because it can work for a while, but life changes, people change. It's unfortunately there's usually not a final answer in what you're doing. I mean, it'll last
Hmm.
for quite a while. But also medicine changes. You've probably seen in the news, we at that first visit, not only do we go through everything, we also make a plan as far as what is your next step for nutrition? What is your next step for activity, both non-exercise and exercise? How do we approach your stress? And medications we offer and often use that first visit and just fine tune it along the way. And as many people know, there are medication changes really coming up right now, and will be for the next several years.
Yeah, absolutely. I kind of like to hit on, you mentioned maybe the opposite of what most people are thinking with overweight management. You said people not eating, and are you guys working with patients to get them maybe to a more healthy weight and every? How common is that?
So, not specifically underweight, we
Okay.
don't. But the interesting part that people aren't aware of with the disease of obesity is a lot of those patients also have an eating disorder. And you might think most commonly about binge eating disorder, but they also may have atypical anorexia. And some of our patients just truly aren't eating enough. It's kind of a funny balance. True, most people are going to lose weight with reducing their calories, but you also have to look at their output and how much they're moving. So if your metabolism is slowed down so much because of calorie restriction, sometimes we have to boost your metabolism, increase your intake a little bit, and increase your activity. It's just so individualized that it gets kind of complicated, but there is a lot of eating disorder conditions, like, or they have a history of anorexia, or they have a history of bulimia. And so we need to make sure those mental stressors, whether they're the eating disorder or just life stressors, almost have to be improved to be successful in weight management. And that's really hard for people to understand.
Yeah, I really believe that. Um, so besides like looking at a scale and seeing success that way, what are some other markers that you guys are looking at for progress with your patients?
Sure. Great point to bring up because we really try to get past the scale. We do a body composition um, at every visit.
Okay.
The first visit they see the provider, so meaning clinician as far as doctor, nurse practitioner, PA, physician assistant, and they also see a dietitian. But we do that in body composition scale so we can monitor body fat, we can monitor muscle mass, we can monitor internal fatty tissue. And so we really try to focus on, I know the scale is all you can see at home and it's all you are aware of, but let's really learn about what is your body made of and how do we keep that distribution of muscle versus fatty tissue balanced better, because then that puts you in better metabolic health. It will improve your appearance too as we maintain that muscle mass. All you got to do is Google or search for what does 5 pounds of muscle versus 5 pounds of fatty
Yeah.
tissue look like, and that's pretty impressive change. So sometimes when patients do come back, they're very frustrated. Their scale hasn't moved, but they've gained muscle and lost body fat. And then it's just so eye-opening and a better experience for them to see that improvement. So as they gain that understanding, it helps, but we all fall back into that scale because it's just so ingrained into our lives.
It sounds like you guys are doing a lot of not only, implementing and giving them, but education side of things to let them know exactly what's happening and what they should be seeing from the education standpoint. I think that's amazing.
Yeah, it's really comprehensive. We spend a lot of time talking through everything, almost every visit, but we're going to focus on what that patient needs that day.
That's great. So more personally towards you, what keeps you passionate about this work, especially knowing how personal and emotional this journey can be for so many people?
Um, it is just so rewarding to be able to help people deal with a condition that they felt so much shame and blame for. And they feel heard, understood, hear some positivity because we recognize that it's a struggle and we'll talk about it. We're not here to shame and blame. There's a lot of weight bias out there.
Hmm.
Um, and so, and people have experienced that so much in their lives that they often have so much internal weight bias. So even if others around them aren't thinking about their appearance or their size or anything like that, they are thinking that we are thinking about that. And that's truly stressful. So if we can help them, I mean, a lot of patients will come in and say, especially now with the holidays recently, well, I didn't do a good job. I'm like, if you've maintained stability or really didn't change much, that's a huge win. And so we
Absolutely, it
celebrate
is.
a lot of those non-scale victories too. So I also, in family medicine, I loved it. I did it a long time. I have wonderful relationships with a lot of patients that I had, and I really miss a lot of them. But the way we run this clinic is I have to spend more time with them. And maybe, obviously physicians should spend more time with patients. It's just not made that way. And with the shortage, we can't necessarily afford to. But I spend a little bit more time with patients than I did before.
Good.
And I get to speak about what I wanted to speak about anyway. So, and then it keeps changing. I am constantly listening to podcasts, reading articles, but usually my podcasts are educational because, we can multitask, lectures, that sort of thing. It's just constantly changing and new. And that's kind of what I love, and to stay interested and keep learning.
Amazing. For someone listening right now who feels stuck, discouraged, or unsure where to start with their health, what's something that you would want them to hear?
I certainly want them to understand that it is a struggle, and that even though they may have tried many things, we can still help and figure that out. I mean, our first answer might not be the right one for you. We just have to keep figuring that out. And then life gets in the way, other people get in the way. So then we just constantly can readjust. We're happy to see them. They can call us themselves and get scheduled. They don't need a referral. But don't just give up.
That's great.
There's lots of
Jen,
options.
is there anything kind of in maybe immediate future, a couple years out that you're looking forward to and that you guys have planned?
Um, in the clinic, I have tons of ideas all the time. It's just a matter of finding the time to implement those. We do have a weight management conference for our second one coming up at the end of February. So that was really well attended by people, mostly providers in our system, dietitians, and others. I am working on a little bit of my own health coaching business that I don't plan to prescribe medications. I really want to be a resource to help people with exercise and nutrition. And I really hope our health system is able to help primary care providers and other clinicians, doctors, advanced practice providers support them in prescribing weight management medications, because really for those patients, for it to work in the long run and be most effective, the nutrition and lifestyle has to come along, and that comes from dietitians, not always covered by insurance, and everybody needs an individual approach. So I'm doing a little bit of that myself and kind of a side business that I'm developing, and hopefully we'll have the website up and going soon.
Yeah, well, when you get that, we'd love to hear more on it. Absolutely, and hopefully help you become more successful. So, Jen, thank you so much for sharing your personal stories. I can tell you're very passionate about the work that you're doing. You're bringing clarity, compassion, and a balance to a topic that a lot of people struggle with quietly. So, thank you for sharing your story and what you guys are doing.
Oh, thank you for all that you do.
Absolutely. Well, thank you everyone for listening. And if this episode resonated with you, please be sure to share it with someone who might need it. And we'll see you guys all in the next one.
Know someone with serious grit and a great growth story? Send them our way at grittogrowthpodcast.com/guest.